Okay, welcome to the deep dive. Today, we're tackling something really important for pet owners, a topic actually sent in by you, the listener. Canine and feline airway collapse.
Mm-hmm.
We've got your source materials here, articles, notes, research, and our plan is, well, to sift through it all, pull out the key information, and give you that shortcut to understand what's going on.
Yeah, it's a complex area, definitely.
We want to figure out, why it happens, what signs you should look for, and apparently there's a pretty unique cough involved,
Oh, yes. Very distinctive.
and how vets approach managing it. Should be some interesting nuggets in these sources.
It's certainly a condition that causes a lot of worry for the pets and the people.
Right.
So understanding it based on this material is key for spotting it early and getting the right help.
Okay, let's start right at the beginning. What is airway collapse, fundamentally? What are the sources actually describing?
So, at its core, it's about the airways losing their normal stiffness, their structural
It's
support.
the tubes that carry air, you mean? The windpipe and all that.
Exactly. The larynx, the trachea, the bronchi. Think of them like flexible hoses that need to stay open. In airway collapse, the cartilage or tissue that holds them open gets weak.
And then they flatten or narrow.
Precisely. They flatten or narrow down, and that blocks the airflow.
Right. And that blockage, that obstruction, is where all the problems start. The breathing difficulty, the sounds we mentioned. It's not just noisy breathing. The sources make that clear. It can be serious.
Very serious. It can severely limit how much oxygen they get, and it can absolutely become an emergency situation. It directly impacts their ability to breathe properly.
Okay, so airways weakening and collapsing. Where does this actually happen? The sources seem to break it down into different locations.
Yes, that's right. The collapse can occur at different points. A key one is the larynx, the voice box. That's laryngeal collapse.
Okay.
And the sources describe it as a progressive breakdown, a weakening of the cartilages in the larynx itself.
Interesting. And the sources seem to suggest this isn't usually the starting point. It comes after something else.
That's a really key point. It's typically secondary. It usually happens because there's already been some kind of chronic blockage higher up in the airway.
Ah.
And this is where we see a very strong link to specific breeds mentioned in the material. It's overwhelmingly found in brachycephalic breeds.
The flat-faced guys.
Right.
Like bulldogs, Frenchies, pugs.
English bulldogs, French bulldogs, pugs, Boston terriers, yes. And in cats, you see it in Persians, Himalayans, those types.
And why them specifically?
Well, their conformation, the short skull, which often leads to things like an elongated soft palate or narrowed nostrils, what we call BOAS.
Brachycephalic obstructive airway syndrome.
Yeah, exactly. That structure creates this chronic increased negative pressure inside their airway whenever they breathe in. It's like they're constantly having to suck harder to get air past those initial obstructions.
And that constant suction over time.
It weakens the laryngeal cartilages, pulls on them, basically, until they start to collapse inwards. The sources even describe stages for this, from stage I, where just the little sacs inside evert, to stage 3, where it's pretty much completely obstructed.
Wow. So their very shape sets them up for this secondary collapse. Okay, that's laryngeal collapse. Where else?
So moving down from the larynx, you get tracheal collapse. This affects the trachea, the windpipe.
Right.
The sources describe this one as a progressive degenerative disease. The C-shaped cartilage rings that give the trachea its structure. They weaken, lose their stiffness, and flatten out.
And this tends to affect a different group of dogs, the material says.
It really does. Tracheal collapse is much, much more common in small and toy dog breeds.
Oh, okay.
The papers you sent consistently mention Yorkies, Pomeranians, Chihuahuas, toy poodles, Maltese dogs.
The little guys.
The little guys, exactly. It's actually pretty rare in cats, unless it's maybe a congenital thing or secondary to something else.
Okay, so laryngeal collapse, often tied to brachycephalics and BOAS. Tracheal collapse more in toy breeds. Anywhere else?
Yes, the collapse can go even further down into the smaller airways inside the lungs themselves, the bronchi and the even smaller bronchioles. That's bronchial collapse, or sometimes called bronchomalacia.
And can that happen on its own?
It can, but the sources note it often happens with tracheal collapse. They call that tracheobronchomalacia. But yeah, sometimes it's just the bronchi.
Got it. Larynx, trachea, bronchi. Different locations. So the big question then is why? Why do these airways lose their shape? What are the root causes, the risk factors that the research points to?
It seems to be a mix of things. Genetics and congenital factors are often right at the foundation,
Born with it, basically.
or at least predisposed. For tracheal collapse, there's a suspicion that the cartilage rings themselves are just congenitally weak. Like the cartilage material might be missing some key components. The sources mention things like chondroitin sulfate,
So
glycoproteins.
the building blocks aren't quite right from the start.
That's a good way to put it. It makes the cartilage less stiff, more prone to flattening. And for laryngeal collapse, well, as we said, those congenital brachycephalic issues, the BOAS components, they are the primary problem that leads to the secondary laryngeal collapse.
Right, the structure causes the problem.
The sources also mention something called hypoplastic trachea, basically a windpipe that's congenitally too narrow to begin with, which also predisposes them.
Okay, so there's often an underlying weakness or structural issue.
Hmm.
How does normal breathing then make it worse?
This is really interesting, the mechanics of it described in the sources. Because the cartilage is weak, the normal pressure changes that happen when they breathe actually cause the collapse.
How so?
Well, when the animal breathes in inspiration, the pressure inside the chest drops, right? But the pressure in the neck part of the trachea, the cervical trachea, becomes negative relative to the outside air. So the atmospheric pressure pushes on the weakened walls from the outside, causing them to collapse inwards.
Okay, so breathing in collapses the neck part. What about breathing out?
When they breathe out forcefully, like during a cough or heavy exercise, the pressure inside the chest increases significantly. This high pressure pushes on the weakened trachea and bronchi within the chest, the intrathoracic parts, causing them to collapse from the outside pressure.
So where it collapses depends on whether they're breathing in or out forcefully.
Exactly, it's dynamic. The sources also mention changes in the dorsal tracheal membrane, that's the soft tissue bit connecting the ends of the C-rings. It can stretch and bulge into the airway too, making the obstruction worse.
That dynamic failure tied to breathing really explains a lot. What other things contribute or make it worse, according to the material?
Well, that chronic airway obstruction we talked about, BOAS or maybe laryngeal paralysis, is a huge driver, especially for laryngeal collapse because of that constant negative pressure.
And does age matter?
It seems to. It's often diagnosed in middle-aged to older pets, probably because the cartilage degeneration is progressive. It happens over time.
Okay, and here's something that really jumps out from the sources because it's often something owners can influence: obesity.
Oh, absolutely. This comes up again and again in the research. Obesity is flagged as a major exacerbating factor.
Why is that? More weight, harder to breathe.
Exactly. The extra weight increases the work of breathing, and fat deposits in the neck and chest can physically compress the airways or just put more strain on those already weakened structures.
So getting weight off isn't just generally healthy, it's directly therapeutic for this.
Critically important, yeah.
Yeah.
Other things mentioned are chronic respiratory diseases like bronchitis, allergies, infections, or breathing in irritants.
Like smoke.
Secondhand smoke is a big one mentioned. Dust, aerosols, anything that causes ongoing inflammation can make the airways weaker or more reactive.
And are there specific triggers that can suddenly bring on the signs?
Yes, definitely. Things like stress, getting really excited, heavy exercise, or even just heat and humidity.
Why those?
Because they all make the animal breathe harder and faster, which increases those pressure changes we talked about and makes the collapse more obvious or severe.
Makes sense.
And even something as simple as using a neck collar, especially if the dog pulls.
Ah, direct pressure on the trachea.
Right. That's why a harness is always recommended in the sources for these dogs. Concurrent problems like heart disease or pulmonary hypertension can also complicate matters, adding to the breathing difficulty.
Wow, okay. A lot of factors involved.
Yeah.
So we know what it is, where it happens, why it happens. Now, for someone listening, what does this look like? What are the telltale signs they might actually see or hear?
The sources list quite a few clinical signs, and some are really quite specific.
Let's start with the sounds. You mentioned that distinctive cough earlier.
Yes. The absolute classic sign, especially linked to tracheal collapse, is what's consistently described as a goose-honking cough.
Goose-honking.
It's a very harsh, dry, sort of paroxysmal cough, meaning it comes in sudden fits or bouts, and it's often triggered by excitement, exercise, drinking water, or, like we said, pulling on a leash if they're wearing a collar.
That is memorable. Goose-honk cough.
Hmm.
Think tracheal collapse, often in those small breeds. What about sounds from the other types of collapse?
Well, for the laryngeal collapse, often associated with BOAS, you're more likely to hear stertor. That's that kind of low-pitched snoring or snorting sound.
Like you hear from a bulldog sometimes, just normally.
Exactly, but it can become much more pronounced with collapse. It originates higher up. from the nose or soft palate area. And then there's stridor.
Sidor.
That's a harsher, higher-pitched, almost whistling sound. It usually indicates a more significant obstruction, often heard with severe laryngeal collapse, or sometimes really severe tracheal collapse near the larynx.
Okay, goose-honk, snorting, high-pitched whistle.
Mm.
What about just their breathing effort?
Difficulty breathing dyspnea is a major sign. You might notice they're working harder to breathe. Maybe more effort on the in-breath if the collapse is in the neck, or more effort pushing air out if it's in the chest or bronchi.
Oh.
They might breathe faster than normal, that's tachypnea, or pant excessively, even when not hot or exercising. Sometimes they adopt specific positions to make breathing easier, like standing or sitting with their neck expanded and elbows out, orthopnea.
Any other signs to watch for?
Yeah, things like getting tired really easily, reduced exercise tolerance, gagging or retching can happen sometimes right after coughing or maybe related to the soft palate in brachycephalics. You might notice a change in their bark or meow, just general lethargy, maybe not wanting to eat as much. And the sources specifically mention that brachycephalics often have that lifelong history of noisy breathing, loud snoring, and really struggling in the heat.
And what are the absolute emergency signs, the get to the vet right now signs?
The sources are very clear on two critical ones. First, cyanosis. That's when their gums or tongue take on a bluish or purplish tinge. It means severe lack of oxygen. That is a true respiratory emergency.
Okay, blue tongue or gums emergency. What's the other?
The other is actual collapse or fainting, which the sources call syncope. This usually happens during or after exertion or intense excitement, again due to that severe lack of oxygen reaching the brain. Also a critical emergency.
Those sound terrifying. Definitely underlines the potential severity. And I suppose during a vet exam, they might find other clues, like touching the windpipe makes them cough.
Yes, increased tracheal sensitivity on palpation is common. The vet might also hear abnormal lung sounds with a stethoscope, things described as an expiratory snap, crackles, or wheezes. And if there's secondary heart strain, like pulmonary hypertension, they might hear abnormal heart sounds or feel an enlarged liver.
Okay, so a vet suspects airway collapse based on the history, the signs, the exam. How do they confirm it? What's the diagnostic path outlined in the sources?
It's definitely described as a multi-step or multimodal approach. Starts with that detailed history from the owner and the physical exam findings, including feeling the trachea carefully.
Imaging must be key. X-rays.
Right. Radiographs or X-rays are often the first imaging step. They can sometimes show the airway narrowing or maybe secondary changes like an enlarged heart or lung issues, but the sources consistently point out a big limitation. They're static pictures, a snapshot in time. And airway collapse is often dynamic. It changes depending on whether the animal is breathing in or out. So a single X-ray might completely miss the collapse or make it look less severe than it really is.
Okay, so standard X-rays might not tell the whole story for a dynamic problem. Is there a better imaging technique mentioned?
Yes, the sources strongly recommend fluoroscopy for suspected tracheal collapse.
That's the moving X-ray, right?
Exactly.
Right.
Real-time video X-ray. It lets the vet watch the trachea move throughout the entire breathing cycle, inspiration, expiration. You can actually see if, when, and where it collapses dynamically.
That makes way more sense for this condition.
It does. It allows for grading the collapse, too, based on how much the airway narrows. CT scans are also mentioned as valuable.
How do they help?
CT gives really great cross-sectional detail of the airway structure. It's good for looking at the overall anatomy, assessing all the components of BOAS and brachycephalics, or checking for any masses, often used alongside dynamic studies like fluoro.
But for really nailing the diagnosis, especially for grading the severity and seeing inside, the sources seem to point to endoscopy as the gold standard.
That's correct. Endoscopy using a small camera on a flexible scope is considered the definitive diagnostic tool. It requires light anesthesia.
Which must be a bit risky in animals that already have trouble breathing.
It definitely carries risks, and the sources emphasize the need for very careful anesthetic management in these patients. But endoscopy allows the vet to directly look inside the larynx, the trachea, and the bronchi.
What can they see?
They can directly visualize the collapse, see exactly where it is, how severe it is. They can assess laryngeal function, look for averted saccules, check for inflammation, masses, foreign objects, and they can grade the collapse, often on a scale of I to IV based on how much the airway is obstructed.
And can they take samples too?
Yes, that's another big advantage. They can perform procedures like a bronchoalveolar lavage, or BAL, flushing a small amount of sterile saline into the airways and collecting it back. That sample can then be sent off for cytology to look at the cells, or for culture to check for infections like bacteria or mycoplasma.
So endoscopy gives the visual diagnosis, the grading, and samples. Is blood work usually done too?
Typically, yes. To check overall health, look for inflammation or infection markers, check organ function, especially if anesthesia or surgery is being considered. And it helps rule out other conditions that might cause similar respiratory signs, things like infectious bronchitis, pneumonia, heart failure, or a foreign body stuck somewhere.
Okay, so it's a process. History, exam, imaging, especially dynamic imaging like fluoro, and often endoscopy for the definitive answer. Once it is diagnosed, how is airway collapse managed or treated based on these sources?
The main goals are to relieve the symptoms, improve the airflow, and give the pet the best possible quality of life. Treatment is usually approached in layers, often starting with medical management and considering surgery only for the more severe cases or those that don't respond well to medication.
Right. What about those emergency situations we talked about? If a pet comes in really struggling to breathe?
Immediate action is crucial. The source is stress. Number one is oxygen therapy. Get them oxygen right away. And then, very importantly, sedation.
Sedation. That seems counterintuitive for breathing problems, maybe.
It sounds it, but the sources explain it's often life-saving. These animals are usually panicking, which makes them breathe harder, get hotter, and makes the collapse worse. Sedatives help break that cycle. They calm the animal, reduce the extreme respiratory effort and distress, slow the breathing, allow them to cool down. It actually helps them breathe more effectively in that crisis moment.
Ah, okay. Break the panic cycle. Makes sense. What else in an emergency?
Cooling measures if they're overheated, hyperthermic. Intravenous corticosteroids can be given to quickly reduce acute inflammation and swelling in the airways. And in the most severe, life-threatening obstructions, they might need to be intubated or even have a temporary tracheostomy tube placed to secure an open airway immediately.
Okay, that's the crisis management. What about the long-term day-to-day management for chronic collapse?
Several key strategies are consistently emphasized in the sources, and the first one, highlighted repeatedly as probably the single most important long-term intervention, is weight management.
There it is again. Obesity.
Yes. For overweight or obese pets with airway collapse, aggressive weight loss is critical. The sources state it can dramatically improve the clinical signs, sometimes even resolving them in milder cases, simply by reducing the mechanical load on the respiratory system.
That's huge. So weight loss first and foremost. What else?
Activity modification, basically avoiding triggers. So limiting strenuous exercise, avoiding situations that cause extreme excitement or stress, and keeping them cool, avoiding high heat and humidity.
And the harness thing.
Absolutely essential, according to the sources. Always use a harness instead of a neck collar to avoid any direct pressure on the trachea. Environmental control is also important, minimizing exposure to airway irritants like cigarette smoke, dust, strong perfumes, cleaning aerosols, things like that.
Okay. Manage weight, manage activity and triggers, use a harness, clean up the environment. What about medications for long-term use?
Medications are mainly aimed at controlling symptoms. Cough suppressants are very commonly used.
Why suppress the cough if there's an issue?
Because the coughing itself can be a vicious cycle. The harsh coughing irritates the airway, causes more inflammation, which triggers more coughing. So medications like hydrocodone or butorphanol help break that cycle.
Okay.
Anti-inflammatories, usually corticosteroids, are often used to reduce the underlying inflammation in the airways. Sometimes these can be given via inhaler, like with asthma medication, which the sources suggest can minimize systemic side effects compared to pills.
Inhaled steroids. Interesting. What else?
Bronchodilators, like theophylline or terbutaline, might be used. The sources are a bit cautious here, noting they don't directly widen the collapsed trachea itself, but they might help relax the smaller airways further down the bronchi, which could potentially ease breathing, especially if there's concurrent bronchial collapse or bronchitis.
Any other meds?
Sedatives or anti-anxiety meds might be used situationally for pets whose signs are really triggered by excitement or stress. Antibiotics are generally only recommended if there's a confirmed or highly suspected bacterial infection, sometimes based on those BAL culture results. And diuretics might come into play if there's also concurrent heart failure contributing to breathing issues.
And for the brachycephalic dogs, the ones prone to laryngeal collapse because of BOAS.
For them, the sources really emphasize that addressing the primary problem is key. Surgical correction of the BOAS components, fixing the narrow nostrils, stenotic nares, shortening the long, soft palate, removing everted laryngeal saccules is often crucial. Reducing that chronic upper airway obstruction can prevent the laryngeal collapse from starting or getting worse.
Right. Fix the underlying structural problem first in those breeds. Okay, so that's medical management. What about surgery specifically for the collapsed airway itself? When is that considered?
Surgery is usually reserved for pets with severe collapse that isn't responding well enough to medical management or those having frequent crises.
And what are the options for tracheal collapse?
There are generally two main approaches described. One is placing extraluminal prosthetic rings around the outside of the trachea to hold it open. This tends to be more feasible for collapse in the neck, cervical region.
Okay, rings on the outside. What's the other?
The other, perhaps more common now, especially for collapse inside the chest, intrathoracic, is placing an intraluminal stent.
That's the mesh tube placed inside the airway.
Exactly. It's a self-expanding mesh stent, usually made of nitinol, placed via endoscopy to scaffold the trachea open from within.
That sounds like a good solution, potentially. Are there downsides?
Oh, yes. The sources dedicate significant discussion to the complications of tracheal stents. They are not a perfect fix.
Such as?
Things like the stent itself potentially fracturing over time. Granulation tissue, basically scar tissue, can grow through the mesh or at the ends of the stent, causing new obstruction. The stent can potentially migrate or move from its original position. Many dogs continue to have a persistent cough, even with the stent. And there's an increased risk of airway infections.
Wow. So it's a trade-off. It might help breathing, but comes with a whole list of potential new problems.
Absolutely. Stents require lifelong monitoring, often chest x-rays periodically, and many dogs still need ongoing medical management like cough suppressants or anti-inflammatories, even after stenting. Owners need to be really well informed about these risks and the commitment involved.
Okay, that's crucial information. What about surgery for laryngeal collapse?
The main surgical procedure mentioned for moderate to severe laryngeal collapse, like stage 2 or 3, is called a laryngeal tieback, or technically unilateral arytenoid lateralization.
Tieback, what does that involve?
It involves permanently stitching one side of the larynx open, pulling one of the laryngeal cartilages, the arytenoid, to the side, to create a wider, more stable opening for air to pass through.
Does that work well?
It can significantly improve airflow and reduce respiratory distress. However, like stents, it comes with a very significant, well-documented potential complication,
Okay.
a significantly increased lifelong risk of aspiration pneumonia.
Because the larynx normally protects the airway from food and water going down the wrong way.
Precisely. When you permanently tie one side open, that protective function is compromised. It makes it easier for food, water, or saliva to be accidentally inhaled into the lungs, leading to pneumonia. This is a major consideration.
Another serious trade-off then. Better breathing, but higher risk of lung infections.
It really is. For the absolute most severe end-stage cases of either tracheal or laryngeal collapse where nothing else is working or possible, a permanent tracheostomy might be considered as a salvage procedure. That's creating a permanent breathing hole in the neck, but that requires intensive, lifelong daily cleaning and care by the owner.
Okay. And bronchial collapse. Any surgical options there?
Surgery for bronchial collapse is much less common and more specialized. The sources mention bronchial stenting is sometimes attempted in referral centers or potentially removing a whole lung lobe, lobectomy, if the collapse is extremely severe and confined to just one lobe. But these are complex procedures with their own risks.
So it's clear management is really tailored, often involves long-term medical care, and surgery has some pretty serious potential downsides. Given all that, what did the sources say about the general outlook, the prognosis?
As you'd expect, it really varies. It depends heavily on which part of the airway is affected, how severe the collapse is, where it's located, and whether there are complications or concurrent diseases.
What about for the brachycephalics with laryngeal collapse?
The sources suggest the prognosis can actually be pretty good if the underlying BOAS is corrected surgically early on before the laryngeal collapse gets really bad, like stage 3. Once it's severe, or if they need a tieback surgery, the prognosis becomes more guarded, mainly because of that constant risk of aspiration pneumonia throughout their life.
Okay. And for tracheal collapse, common in the toy breeds.
For mild to moderate cases that can be managed well medically, especially with aggressive weight loss, environmental changes, and medications, the sources suggest they can often maintain a good quality of life for quite a few years.
But it's progressive, right?
Yes, that's a key point. It's typically a chronic, progressive disease. It doesn't usually get better on its own and often worsens over time. Even with surgery like stenting for severe cases, it's not considered a cure. Stents can improve breathing and quality of life significantly, but they come with those long-term risks we discussed. The condition can still progress around the stent, and most animals will need lifelong medical management anyway.
And bronchial collapse.
That generally carries a more guarded prognosis as well, often requiring pretty intensive ongoing management. So the overall message seems to be it's rarely cured. It's something that needs to be managed, often for the rest of the pet's life.
Right. So living with airway collapse really means ongoing monitoring and care. What should owners expect in terms of follow-up?
Regular vet checkups are definitely essential to monitor how the condition is progressing, assess how well the treatment is working, and make adjustments as needed. And continuous weight monitoring is absolutely critical. The sources just keep coming back to that.
Yeah, that message is loud and clear. Keep the weight down.
It's often that single most impactful thing owners can do long term.
And owners need to be watching closely at home, too.
Definitely. Owners play a huge role in monitoring, watching the pet's breathing rate and effort at rest, noting the frequency and character of any coughing, tracking their exercise tolerance and energy levels, reporting any changes to the vet promptly. Periodic recheck imaging like X-rays or maybe fluoroscopy might also be recommended, especially if a stent is in place, to monitor the airway and the device itself.
Okay. So what are the absolute key take-home messages that the sources suggest vets need to communicate to owners navigating this?
There are several crucial points for client education that come through. First, helping owners understand that this is usually a chronic and progressive condition. It's generally not curable, but it is manageable with commitment.
Manageable, not curable. Got it.
Second, making sure owners can recognize the signs of an acute crisis, that severe difficulty breathing, the blue gums, collapse, and understand that these are absolute emergencies requiring immediate vet care.
Don't wait on those signs.
No. Third, reinforcing again and again that weight management is often the single most important long-term tool they have. Fourth, the practical things. Avoiding smoke and other irritants, consistently using a harness, not a collar. And fifth, having a really open and honest discussion about the treatment options, medical versus surgical. Talking through the pros and cons of each, the expected outcomes, the potential costs, which can be significant, especially for surgery and long-term care, and being very clear about the risks and potential complications, particularly with procedures like stenting or tiebacks.
So everyone's on the same page about the commitment and the potential challenges.
Exactly. The focus should be on working together, owner and vet team, to create a plan that prioritizes managing symptoms effectively and maintaining the best possible quality of life for that individual pet. And the sources often recommend referral to a veterinary specialist, like an internist or surgeon, for complex or severe cases.
That's a really comprehensive picture. It's definitely complex, but breaking it down based on these sources makes it much easier to grasp the key aspects.
It really helps to have that framework, doesn't it? Understanding the different types, the causes, the signs, the options. It empowers owners to be better advocates for their pets.
Okay, we've definitely done a deep dive today. We defined airway collapse, looked at where it happens, larynx, trachea, bronchi, and those important breathe lengths. We dug into the why, the mix of genetics, structure, those dynamic pressure changes, and factors like obesity. We covered what it looks like, those specific sounds, the breathing changes, the emergency signs, then the diagnostics, from imaging like fluoroscopy to the gold standard endoscopy. And finally, the management emergency steps, the crucial role of weight loss in medical therapy, and the surgical options with their significant risks. We really pulled the core knowledge from the listener sources on this one.
Yeah, and it really highlights how variable these conditions are. The approach needs to be tailored to the individual animal, the specific type and severity of their collapse.
Absolutely. So as we wrap up, here's something to maybe mull over based on everything we've covered from these materials. Given how chronic and progressive these conditions often are, and the clear role of things like breed predisposition, the structure of brachycephalics, the cartilage issues in toy breeds, plus the major impact of a controllable factor like obesity, what does this deep dive really tell us about the responsibilities that come with pet ownership today? About being aware of breed-specific health risks, and maybe the importance of proactive health management right from the start?
That's a really important point to consider. It certainly underscores the need for prospective owners to do their homework on breeds they're interested in, to understand the potential health challenges that might come with them. And it emphasizes that commitment to lifelong care, including preventative things like, as we've said so many times, maintaining a healthy body weight from puppyhood or kittenhood onwards.
Food for thought, definitely. Well, thank you for sharing these sources with us and allowing us to do this deep dive. It's been really informative.